So the guidelines really are based on identity. And so right now, the guidelines for cisgender heterosexual men and women are not necessarily great because of a lack of evidence around those demographics. For same gender loving men, the guideline is at least once a year. My personal guideline for my patients and my clients is at least once a year. I am a married man of many years, and every year when I go and get my annual, I ask for a full STD panel. And it has nothing to do about my marriage or my trust of my wife. It is a practice, it's a habit. It's one that I had before I was married. It's one that I'll continue to have. And it's one that I advocate for in my patients and in my communities. And so once a year for sure. As folks age, the guidelines become less stringent and they become based on risk. But as Dr. Crawford mentioned, people don't stop having sex once we age, thank God. And people who continue to use substance use when they age. And this is a blind spot for a lot of clinicians. A lot of people over the age of 50 will go to their doctors, and their doctors won't recommend that they get tested for HIV or other STDs. And that's a social construct, right, that we have to deconstruct even in our healthcare settings. And so, as a person, you have to then advocate for yourself when you go into these
Absolutely.
patient rooms to say, hey, I need to get an HIV test. And oftentimes your clinician will be like, oh, you don't need to do that because of whatever they've decided about you based on your profile or your age. And you say, no, I think I do. And I think so that's how we kind of have to co-labor in this work together with clinicians to make sure that we are covered. I want to backtrack and add to the conversation about prevention. Um, I, I love Dr. Morrison's framing around prevention as a spectrum, and that information and education can serve as a way of prevention. And then Dr. Crawford added to that with the biomedical tools that we have for prevention. But the one thing that's still missing from our prevention toolbox is an effective vaccine. We have never eradicated a disease without either a cure or a preventative vaccine. And we don't have either for HIV. And I don't believe that we will end the HIV epidemic with antiretrovirals alone. And so my colleagues and I at the HIV Vaccine Trials Network have been laboring for 30 plus years now to try and discover an effective HIV vaccine. And we've had little success, but I don't call them failures because with every downside, we've learned what didn't work. And then we could try now what does work. And all of that research was the foundation, was the platform for the speed for which we were able to develop in COVID-19